Today on Family Medicine Physicians On Call for Colorado, we're dispelling the myths around safe pregnancies and taking a look at what every young adult should know about their health risks and what you can do now to fine-tune your health as you get older. We'll also take a look at fever phobias and when you need to take action. We'll give you the facts on obesity, how you and your family may be at risk and not even know it. The statistics are staggering, and we'll give you the facts on this health issue that is affecting millions of Coloradans. I'm Dr. Robert Brockman, President of the Colorado Academy of Family Physicians, and joining me today are my fellow family physicians, Dr. Taman Osborne-Roberts, Dr. Kaisa Harris, Dr. Joseph Castro, and Dr. Lisa Rothgary. Through rigorous training, internships, residencies, and specialty board certifications, they are uniquely qualified to care for patients during all phases of life and treat nearly every medical condition. Together, we'll take a look at important health topics to give you the information you need for a healthy life. This program is a public service of the Colorado Academy of Family Physicians. Whether it's your first pregnancy or your third, expecting women want to avoid anything that can place their pregnancy at risk. Dr. Harris has been a family physician since 1997 and is passionate about wellness and health. Dr. Harris, some people think only an OB/GYN can take care of a pregnant woman, but that's not really the case, is it?
That's certainly not the case, Dr. Brockman. While it's true not all family physicians deliver babies, all family physicians have received training in how to take care of a woman before, during, and after a pregnancy. This makes family physicians uniquely qualified to help a woman through their pregnancy, even if they do not actually do the delivery. Even better, they are also trained to take care of a baby as well. I think on most people's mind is, what do I need to do to have a healthy pregnancy? I think the best way to have a healthy pregnancy is to be healthy before the pregnancy even starts. What does this mean exactly? Well, for example, eating a healthy diet, exercising regularly, and staying up to date on immunizations will give a woman a head start to being healthy in pregnancy. Smoking is not only bad for the mother, but it is bad for the baby as well. So seeing your family physician to help stop smoking before a pregnancy makes a lot of sense. Going into a pregnancy at a healthy weight also is helpful. So to summarize, your family physician can help you to be healthy before the pregnancy, and these same habits will make you healthy during and after the pregnancy. I think my favorite part about taking care of a pregnant woman is all the interesting questions people have about what is safe during pregnancy. I'm always amazed at all the myths that surround pregnancy. One morning early, I received a panicked call from a patient of mine. She was sobbing on the phone. I think it took me 5 minutes to calm her down so that I could understand what was wrong. She had woken up that morning, realized she had slept on her back, and thought she had harmed her baby. I reassured her that it was unlikely that the baby was hurt and asked her to come into my office. We checked the baby, and the happy ending was the baby was fine. She told me one of her girlfriends had told her that if a pregnant woman sleeps on her back, she can cut the blood supply off to the baby and cause harm. This is absolutely not true, and it is safe to sleep in any position that is comfortable during pregnancy. Another common myth that is out there is that pregnant women can't consume caffeine.
That is a really common myth. I had a patient tell me that during her third trimester, she walked into a local coffee shop and the barista absolutely refused to serve her.
Yeah, I've had women tell me that as well. At this time, there is no evidence that moderate caffeine intake is harmful to the baby. One myth that I don't get asked about a lot because people seem embarrassed about asking is it safe to have sex while pregnant?
Well, there's absolutely no question that anyone should be afraid to ask their family doctor.
I agree, Dr. Castro. If you're thinking it, so is someone else. We are here to answer all those questions, even the embarrassing ones. As it turns out, if you have a healthy pregnancy, sex is absolutely safe, though there are some pregnancy complications that occur when we would counsel a woman to avoid having sex. So it is really a good question to ask. So, Dr. Brockman, women should see their family medicine physician regularly, even when they are not pregnant. We can help them to stay healthy before, during, and after pregnancy, and we are always here to answer any question and dispel the myths regarding safe pregnancies.
Our next family physician is Dr. Lisa Rothgary, who has a family practice in Parker, Colorado, and is an active outdoor enthusiast. Dr. Rothgary, the number of obese adults and children is staggering. Can you tell us what we need to know?
Over 78 million U.S. adults and about 12.5 million children are obese. And Dr. Brockman, these numbers are staggering. When you realize that obesity is linked to many other health problems, including diabetes, high blood pressure, high cholesterol, heart disease, and stroke, you can see why physicians and healthcare agencies are so worried about weight. What many people don't realize is that by eating healthfully and exercising regularly, they can often avoid developing these medical problems, and in some cases, changing their lifestyle can even make these diseases go away.
So obesity is a real medical condition. Can you share with us how doctors determine if someone is obese?
Sure. Obesity is defined as a BMI over 30, which lends itself to the next question: what is a BMI exactly? BMI is your body mass index. It's a number calculated from your weight and your height. For example, a woman who is 5 foot 6 inches tall, who weighs 186 pounds, has a BMI of 30. This woman would be considered obese. A healthy BMI ranges from 18.5 to 24.9. Someone is considered overweight if his BMI ranges from 25 to 29.9, and as we said before, a person is classified as obese if his BMI is 30 or above. If you would like to figure out your BMI, our website has a BMI calculator that you can use. There are many socioeconomic causes behind America's obesity epidemic. All these causes, however, have two major effects. Americans are eating more calories and exercising less. This map shows how the number of obese Americans continues to increase in the U.S. In any state that is yellow, orange, or red, 20% or more of the population is obese. As you can see, every state in the U.S. has greater than 20% obesity, and Colorado, thought of as a very healthy, active state, made the transition to a yellow state in 2010. A lot of my patients come to me asking for advice on weight loss. The first thing I tell them is that weight gain and weight loss hinge on one simple principle. If we take in more calories than we burn, we gain weight. If we take in fewer calories than we burn, we lose weight. Think of it as calories in versus calories out. It's easy to think that if weight loss just depends on calories in versus calories out, that you can go on a crash diet every time you gain weight, and the extra weight will just melt away.
And in my experience, that just never works.
Unfortunately, no. Most fad diets don't provide appropriate nutrition and often fail in the long term.
Not to mention, there can be unintended health consequences.
That's a very important point as well. So as you can see, the key to a healthy weight isn't recurrent crash dieting. It's having a healthy lifestyle that focuses on both healthy eating and regular exercise.
So what advice do you give your patients to help them maintain a healthy balance between calories in and calories out?
To maintain a healthy balance, you need to keep your calorie intake within your daily calorie needs. That doesn't mean you have to give up your favorite foods, but you do need to actively try to incorporate fruits, vegetables, and whole grains into your meals. A healthy diet also includes lean meats, fish, beans, eggs, and nuts, as well as fat-free or low-fat dairy products. When looking for guidance, the food pyramid or the new food plate can be very helpful. You should also incorporate regular exercise into your life. An adult should set a goal of about 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise. Moderate intensity exercise includes activities like walking and pushing a lawnmower. Vigorous intensity would be like running, and playing basketball.
And before starting any exercise program, it's a good idea to discuss it with your family physician first.
We also recommend trying to increase your activity throughout the day. For example, do simple things like walking to the store if you can, or take the stairs instead of the elevator.
You know, Dr. Rothgary, many of my patients work long hours and have many responsibilities. And they tell me, I just don't have time for anything except fast food. Well, I tell my patients, a little planning goes a long way.
Definitely. Fast food is not the only way to eat on the go. Many Americans work long hours and have little time to prepare meals, which can make it hard to eat healthfully. But if you make your and your family's health a priority, it can be done. Some tips for eating on the go include: plan ahead. Bring healthy snacks and meals with you so you don't end up picking up unhealthy fast food. For example, pack quick healthy snacks like apples, raw nuts, low-fat yogurt, or dried fruit. Or make easy on-the-go meals like peanut butter and banana on whole wheat sandwiches, or low-fat cottage cheese with fresh berries. Keep your fridge and pantry stocked with these types of foods so they are easy to grab and go. When dining out, it's often best to focus on portion size. Try ordering a lunch portion of your meal or split your meal in half and take half home. Pack a nutritious lunch so you don't end up running out for fast food. I'd also add that the best way to avoid obesity is to be aware of things that trigger eating and always be mindful of what you're eating. If you're a parent, be a role model for leading a healthy lifestyle. Encouraging exercise and healthy food choices will create great lifetime habits for your kids.
That's great advice, Dr. Rothgary. Sometimes the simplest tips provide the greatest rewards. We hope you take advantage of the tools we've talked about today so you can be an active part in fighting the battle of obesity. We've all heard the term fever phobia, but do you really know what that means and how it affects our decisions when caring for our children? Dr. Castro is the chief resident at Southern Colorado Family Medicine in Pueblo and is an advocate for lifelong learning. Dr. Castro, why is this topic so important?
Thank you, Dr. Brockman. I chose this topic because it is extremely important for family physicians and patients, especially parents, to know how to deal with the dreaded fever. In 2012, the American Family Practice Journal reported that fever accounts for an estimated 1/3 of the pediatric family clinic visits. Does this seem like a reasonable estimate in your practices?
Yes, it does.
With the fever phobia that persists in most communities, it is important that your family physician take the time to educate patients on what a fever is, when to treat, and how to treat it safely. Most importantly, parents should understand that fever is not the enemy. In fact, fever is a natural response to the body to help fight infection. So if a fever is defined as a temperature greater than 100.4, when is it necessary to use your fever-fighting arsenal? The answer actually has little to do with the severity of the fever. It is not always imperative to treat a fever just because it's 102 or even 104. What is important is how your child feels. Along with fevers being a natural response to infection, they do tend to make us feel miserable. And it's this miserable feeling that is the real reason to treat a fever. Consequently, if your child has a temperature of 102 but is relatively comfortable, reducing the fever is not mandatory.
My patients are always concerned that a high fever will cause seizures.
You know, I get that question a lot in my clinic as well, and the simple answer is it's not true. Studies indicate that there is no evidence that reducing a fever prevents febrile seizures. In fact, some believe that it's the rapid change in temperature that triggers these events. Another question I am often asked in my clinic is, will a high fever as high as 104 cause brain damage?
Well, that's a medical myth.
Absolutely. There is no evidence that shows having a high temperature will create permanent damage. So when should you be concerned about fevers? Well, when your child is less than 2 months of age, you should definitely consult with your family physician for any fever. So what have you found that works when educating your patients on fever phobia and other related concerns?
Well, I always ask the parents about whether or not the child is taking fluids. If they're not drinking fluids, I'm concerned about dehydration, and that can be far more concerning than a fever.
That's a very important point.
Another important point is asking about activity level. If a child is too sleepy, that can indicate severe illness as well.
Absolutely.
So not every fever needs to be treated, and what doctors and parents should be paying attention to is how the child looks and what might be causing the fever. But if you do decide to treat a fever, we use 2 medicines. One is called Tylenol or acetaminophen. The other one is ibuprofen, sometimes marketed as children's Motrin. Can you explain to the viewers how to properly use those medicines?
I'm glad you brought that up, Dr. Brockman. Here are the recommended dosages for both acetaminophen and ibuprofen. Notice that the doses are based on weight. The biggest concern out there today is accidental overdose. Studies indicate that half of all parents do not administer correct dosage when treating fever. To complicate things further, acetaminophen, commonly known as Tylenol, is a common component of many over-the-counter cough and cold remedies. So it is extremely important to read labels carefully in order to avoid unintentional overdose. And remember, you can always call your family physician to help clarify dosing.
Thank you, Dr. Castro. For more information on these important topics and other important health tips for living well in Colorado that are recommended by your family medicine physicians, visit coloradoafp.org.
You have a family history of diabetes. Know what it means to your health. You've just turned 50. Know what screenings you'll need to add to your annual physical. Your new parents. Know what vaccinations are recommended for your children as they grow.
Through life, you need to know what will keep you and your family healthy. Get involved, know the facts.
Because knowledge is the new doctor-recommended apple of the day.
Visit coloradoafp.org for your free Know card and begin your family health story. It's knowledge for all ages.
If you're a young adult, you might not be aware of just how important it is to have a relationship with a family medicine physician, and you might not know that you are at risk for certain conditions that affect just younger adults. We'll take a look at the myths and facts related to young adults and their health, and what you can do now to fine-tune your health as you get older. Dr. Taman Osborne Roberts is a family care physician at the Salud Family Health Centers, where he cares for the underserved. His philosophy revolves around delivering high-quality care for every patient. Dr. Roberts, let's get to the facts.
And let's just jump right in and start off with the myth, shall we? Namely, that young, healthy adults do not need to have a regular relationship with a family physician. How many of us have heard this from our young patients?
Yeah, all the time.
If they even come in at all.
True enough. It's certainly a very common opinion, but in reality, it's just as important for young, healthy adults to see a family physician regularly as it is for anyone else, for pretty much the same reason that it's important to have a regular mechanic for your car. Even if a car is running well, you should check the oil, rotate the tires, and do routine maintenance so that it continues to run well. A body is no different, and a doctor is essentially a body's mechanic. Through regular yearly visits, a family physician can advise a young adult on all the things to do or not do in order to keep their body running well. And if anything does come up, a family physician who knows you and your body will be better able to help you. Which brings us to another myth. That young people are always at lower risk for all medical conditions. This is simply not true. In fact, young adults are at higher risk for several medical conditions, including trauma. Who here is taking care of a young, injured patient lately?
I just had a swimmer swim into the wall and get a concussion.
That's a fantastic example. Whether involved in team sports, enjoying our active Colorado lifestyle, or perhaps partying just a little too hard, young adults are more likely to be injured than many other parts of the population. And having a family physician who knows them can make healing from an injury a lot easier. Family physicians set and cast broken bones, put in stitches, treat concussions and severe sunburn, deal with sports injuries, and otherwise care for people with mild and moderate trauma. And by giving great advice on protective gear like helmets, seatbelts, and sunscreen, and conducting sports physicals, we help prevent injuries from ever happening. Additionally, many young adults choose to become sexually active for the first time, which places them at greater risk for many conditions associated with sexual activity. How many of you have seen sexually active young adults in your practices recently?
Yeah.
All the time.
All the time. Pretty much everybody. While the most common of these conditions include sexually transmitted infections, other difficulties, such as sexual dysfunction and pain, or even yeast and urinary tract infections, can be associated with starting a sexual relationship. Since these conditions can often be easily prevented or treated, but may be a little difficult or embarrassing to talk about, it is even more important to have a good relationship with a trusted family physician so that they can help you through any bumps in the road. Speaking of sex, and as Dr. Harris has so eloquently pointed out, many young adults are also concerned about pregnancy. As most of us know, starting a family is a big decision, and family physicians can help young adults manage this process, whether counseling patients on their fertility, managing their pregnancies, prescribing and placing contraceptives, including implants and IUDs, or performing vasectomies and tubals. Family physicians can help support the choices that young people make about starting their families. So remember, no matter what age, no matter what's going on, it's always important to see your family physician regularly.
We've covered a lot of ground today, and thanks to our family physicians for giving us the facts and information that will keep Coloradans healthy. You've learned a lot about the important role preventive action plays in avoiding health issues and developing a close and lasting relationship with your family physician that can help you to live a healthy life and lifestyle. The health of our patients is always our top priority, and as you've heard, family physicians provide comprehensive and inclusive health care for people of all ages throughout life. We are always seeking ways to improve the care we provide, and one important consideration is how that care is delivered. Let's take a look at something you'll be hearing a lot more about, and this is our vision for family medicine practices of the future, the patient-centered medical home. The patient-centered medical home is a physician-led team of healthcare providers. It's your medical home, and you will receive the expert medical care that treats you as the whole person you are. Any care you need is provided in a seamless environment and coordinated between all of your healthcare team members and all of the places you may visit in the healthcare system. For example, imagine your teenager has an unfortunate accident on his bicycle, and after a visit in the ER, you are asked to take your son to your family physician for a checkup on his brand new cast. When you call, you get an appointment right away. When you arrive, your physician already has the report from the ER, can see the x-rays, and knows all about what happened. Your physician also knows your son has diabetes, and noting that his blood sugars are not under control, sets your son up for a follow-up visit in a few weeks, when he will not only have his cast removed, but at the same visit, attend a diabetes education class right in the office and tailored just for teenagers. He'll end his visit that day with a short review of his medications with the diabetes educator, who also works right in the office. Later, he'll get a text message from a care coordinator checking in to make sure he's taking his medicines properly and answering any questions he might have. This idea that you can get all of your medical care by a team of healthcare professionals working together who have the same information about you, who communicate with you and other doctors, with care that is readily available when you need it, and is your primary point of contact within this complicated healthcare system, is the essence of a patient-centered medical home. The care you will receive in a patient-centered medical home is oriented to your healthcare needs. That's why it's called patient-centered. Current medical home practices have been shown to improve quality of care, lower costs, and improve patient satisfaction. This concept is an idea that's sweeping the country, and Colorado is at the forefront. Coordinating all of your health care through a medical home with your family physician guiding the process is a common sense idea, and this is how we envision family practices evolving. Dr. Osborne-Roberts, Dr. Harris, Dr. Castro, and Dr. Rothgary, thank you for sharing your knowledge with us today. And for our viewers, be sure to visit coloradoafp.org. You can download your family medicine physician's Know Card, a free guide that will help you record every aspect of your family's own health history, important information to have handy. In addition to what we've learned today, the website provides more great information to keep you and your family healthy for a lifetime. I'm Dr. Robert Brockman. Thank you for joining us for this edition of Family Medicine Physicians On Call for Colorado.